Well, thank you for the invitation to participate in this workshop. I'm an epidemiologist by training, and for the first 12 years of my career I conducted and published epidemiology research until I moved into a series of administrative positions. And until recently, for the previous 15 years, I was corporate director of product safety for Dow. And in that context, had a fair amount of experience in, I would say, sharing epidemiology, toxicology, exposure information, and sometimes data. My experience is somewhat like Lynn's. Very few requests actually to share the raw data. And I'll come back to this distinction between information and data later. Information for me is at a higher level. I titled my slides "An Industry Perspective," but to be frankly more accurate, it's a perspective of someone who's worked in industry for 35 years, because you can see on my first bullet point, the chemical industry doesn't really have yet an official position on data sharing. However, last Friday we engaged in a very robust discussion about this topic, and I think there's a commitment to explore it further and develop some principles. I would also preface my remarks in general by saying that as someone who's trained as a scientist, my bias is towards data sharing. It conforms to my own personal view that we need greater transparency to build more trust, something that's in short supply, unfortunately. However, data sharing is not without its challenges. The industry is both a generator of data and, of course, the recipient, went too far, excuse me, a generator of its own data as well as a recipient of regulatory decisions that are based on data generated by others. I would also point out that we make our own risk management decisions based on these data. And I can't emphasize the importance of getting the data correct. A lot's at stake for all three pillars of sustainability: environmental, social equity, and economics. And I think many of you know this, but some of you may not be aware that any raw data that industry generates to support a product registration is accessible to the relevant government authorities under a variety of statutes here in the U.S. and also abroad. And the vast majority of these data will have been from animal toxicology studies that were conducted under GLP, good laboratory practices. And I can personally attest, as someone who ran a large in-house toxicology laboratory, that US EPA comes in unannounced and will audit the data, all the raw data, and as a consequence we have to keep the tissue blocks and the slides for 35 plus years so that they can audit again in the future if necessary. Industry also has an obligation to ensure that our risk management decisions are based on the best available science, which doesn't necessarily mean that we take immediate action based on the most recently published scientific paper purporting to find an association or a novel effect, but rather we need to certainly consider it in the context of all other existing information and apply a weight of evidence approach. I would say industry does believe that all relevant health and environmental information, and again, not necessarily the raw data, but the information enough to take prudent action to protect human health and the environment, should be publicly accessible. And the chemical industry in particular has a number of initiatives underway to make the amount of information available on its products more accessible. I would say we prefer to share robust summaries rather than the raw data, and I'll explain why in a minute. Somewhere in investigating this topic, I came across this categorization of some of the challenges. I thought it worked well, and so I grouped my comments accordingly. I'm not going to talk about all 5 categories. I'm going to focus on the administrative, financial, and public health. I think others have talked about privacy and the technical issues. One of the fundamental administrative challenges that we face is who owns the data. I think Lynn or someone else brought this up earlier. A not inconsequential number of toxicology studies were conducted by industry consortia. Groups of competitors who came together years ago to share the costs and of conducting the fundamental toxicology research. And over the years, some of those companies have been absorbed into other companies via mergers and acquisitions. In a few cases, this has happened multiple times. And in other cases, companies have gone out of business. And in trying to sort out all of this to find someone who can make a decision about data sharing is difficult. We found this out in particular with REACH, which required data sharing. I'm familiar with the REACH regulations in Europe that govern chemicals. As you can imagine, too, not all competitors play nicely together, and some even resort to gamesmanship to try to exclude competitors from the market. And things could get nasty and messy in a hurry in these discussions. Some of the other administrative challenges include the fact that various organizational policies and procedures and logistical issues differ. For example, different IRBs have different rules. Let me skip ahead to the financial challenges. There are financial challenges to sharing data. Firstly, data generated by the industry have commercial value. This is recognized under FIFRA and similar pesticide regulations globally. Less so under TSCA, but EPA is talking about it with the endocrine screening program, and under EU REACH. Each of those regulations provide for exclusive use of the data by those who bore the costs of generating the data, and for fair and just compensation to them by others who want to use the same data to achieve their own registrations and access to the market. And the goal here is, of course, to prevent free riders and preserve the incentive for companies to invest in innovation and research. The regulatory agencies are obligated to protect the commercial value of the data. In every case, there are time-limited, designated time limits that apply to how long one can try to recover compensation, usually in the range of 5 to 15 years. And that data compensation is becoming even more important as the rise of low-cost competitors from particularly Asia and Eastern Europe has increased. And these competitors already have some built-in advantages, and frankly, we don't need to subsidize them by giving our data away to them. I spent 3 years living and working in China and saw firsthand how the local producers perform from an EH&S perspective. Our folks would wonder, why does it cost us $30 million to build a plant in China when the local producers could build it for $10 million? Well, a lot of that was EH&S protections that were built in. And then finally, I'm sure this has been brought up, who's going to pay for the data sharing, the gathering of the data? This is my last slide. When is data sharing and reanalysis improve public health? Of course, this should be our primary goal. Otherwise, why do we do it? Well, certainly it is when the reanalysis generates more valid findings than the original, and it isn't when reanalysis doesn't deliver better results and we only delay the process. I think one final lesson would be investigators, in my view, particularly university investigators, are often very naive about the work that they're doing and how it might impact society. And they have to understand that their findings have enormous implications, not just for public health, but also for, there are huge financial interests at play, regulatory initiatives, court cases, and then employment issues. So with that, I'll stop. Thank you.